Well, thank you, Arnie. You know, one time I chaired the Oversight and Investigation Subcommittee, and as you said, this is a relatively non-controversial topic. I know that the Health Subcommittee is having a big hearing tomorrow. The first thing that we did as chairman of the Oversight Subcommittee, we swore people in. I don't think you want to be there. Tomorrow, no. Actually, you ought to be there. I know a good number of you will be there. It is an important hearing as the process moves forward, and I'll just stop for a moment and say that I'm very proud myself representing Southwest Michigan. Everyone from Michigan goes like this. Unless you're from the Upper Peninsula and then you go like this. But coming from Southwest Michigan, I represent Kalamazoo. And Kalamazoo, we are proud to have Pfizer's animal health headquarters there with nearly 1,000 folks. I've been to that operation virtually every year during my career. We're delighted to have that facility there. But more importantly, as Americans, we're excited to see the progress that they've made, not only there at Pfizer, but other operations around the world, to in fact do exactly what Arnie said in terms of the mission, to connect human and animal health together. It is a very important role that they do fulfill, and an issue that is of extreme importance, not only to Southwest Michigan, but to the nation and the world. I want to thank CQ and Roll Call for putting together this forum. I'm only sorry that Congress and the issues and things that we have on our schedule will take me away from listening to the discussion, but I look forward to hearing about it in the days ahead, because as we look to address the increasing and ever-evolving challenges related to public health worldwide, the association between animal and human health needs have to be taken into account. Nothing gets the attention that pandemics or the threat of pandemics can bring. Over the last number of years, we've seen the threat of several of these pandemics, and I don't have to tell you about the reaction that these threats have garnered among governments, the media, and the population worldwide. I have one county in my district that has 10 times more hogs than people. And the hog farmers in my district would attest that they saw demand and prices plummet as the result of H1N1 or swine flu, as it was reportedly repeated. That scare last year, even though the consumption of pork had absolutely nothing to do with the transmission of the disease, impacted a lot of folks and a lot of economic activity in my corner of the state. Understanding the epidemiology behind diseases and infections in animals is crucial to maintaining the public health of humans. Experts report that over 60% of the infectious diseases that impact human health come indeed from animals. New pathogens are discovered around the globe every single year, some affecting both humans and animals alike. These diseases, known as zoonotic diseases, have become increasingly difficult to control and isolate, especially in the area of globalization and the burgeoning economies in the third world. Now, I'm not an expert on these individual diseases, not by a long shot, and I would leave that good work to the folks that we have on the panel today, as well as the congressional panel tomorrow involving both the FDA and the CDC. But my job as a member of Congress is to make sure that the infrastructure of government and the private sector is in place and functioning to perform their respective roles, namely to foster innovation in order to protect our global health. We need the government to maintain a stable, transparent, regulatory, environmental base on sound science. And we need to ensure that the government agencies charged with protecting the public health, such as the FDA, CDC, in fact have the tools necessary to do that job. There are currently over 1,000 veterinarians working for the federal government who do inspections virtually every single day. And these folks are the real experts, and they must be given the means to perform their tasks to do the best of their ability. There continues to be a focus on FDA's shortcomings, but we rarely mention its strengths. Across the globe, FDA is known as having a transparent yet strict regulatory process that is based on science. And that process helps explain why the U.S. leads the way in the research and development of new drugs to treat humans and animals. It is virtually and vitally important that we keep that pipeline for the research, development, and application of these drugs. This is not just an issue of public health. It is an economic one as well, big time. If Congress or the agencies responsible for the Public Health act in an arbitrary fashion that is not science-based or creates unnecessary bureaucracy that blurs the transparency, then companies will respond accordingly to manage that risk. They could end research projects or drop research in entire fields, like infectious diseases, or move it to another country. Moving jobs and intellectual property would otherwise generate wealth, opportunity, and jobs in this country. In these economic times, we should not stymie innovation and risk jobs by implementing legislation or regulation in a reactionary way. And as a policymaker, one of my priorities is to, in fact, ensure that the government policies support continued innovation into new treatments and that the infrastructure is in place to protect the public health functions properly, not taking action that will do the opposite. Any action undertaken by Congress or the administration on this issue should be done so judiciously and carefully and in a bipartisan way. Politics should not enter this process at all. I cannot stress enough that the most important aspect of the collaboration between government and industry is adherence to transparency and sound science. Congress, FDA, CDC, and the private sector cannot lose sight of that. The government and private sector infrastructure in place and functioning, I know that we have the resources to meet our global health challenge. Forums like this are the perfect opportunity for the real experts on these issues to come together and address them in a balanced, non-political way. Look forward to their ideas and thoughts. I know that they'll be involved in the process throughout. The hearing tomorrow is just another step in that process. And I, for one, look forward to working with all parties to make sure that our health supply, our animals, and both in animal as well as human population, are protected to the greatest extent that we can. Thank you all very much. Have a great day.